The air in O3 crackled, a symphony of beeps and hushed commands. Dr. Kenji Tanaka, the chief vascular surgeon, moved with the unshakable confidence of a god. Sofia Petrova, her Eastern European features stark against the sterile drape, lay before them, her life hanging by a thread, an acute type A aortic dissection demanding an immediate TEVR. This was Tanaka's domain, his procedure, his triumph. At the edge of the operating field, Javier Kimani, the rookie nurse, felt the weight of the room. His hands, steady from a life he rarely spoke of, meticulously prepped instruments, his African-Hispanic heritage and junior status making him nearly invisible in the elite Aegis Medical Center. Fluoroscopy, pre-graft positioning, Tanaka ordered, his voice crisp. The live feed bloomed on the screens, a pulsing, intricate roadmap of Sofia's internal landscape. As the guiding wire navigated her complex anatomy, Javier's gaze, unnervingly sharp, snagged on something subtle, an almost imperceptible flicker. A silent, monstrous danger, missed by everyone else, was about to be irrevocably sealed. He was just a rookie, but he possessed a sight no one knew, and Sofia's fate would soon rest on it. He had to see it. He would save her. The air in Operating Room 3 at Aegis Medical Center was a meticulously filtered, climate-controlled testament to modern medicine, yet it thrummed with the raw, untamed energy of life and death. Above Sofia Petrova, draped in sterile blue, a constellation of monitors winked and chirped, displaying her vital signs in a vibrant, urgent kaleidoscope. Dr. Kenji Tanaka, a man whose reputation preceded him by several continents, stood at the helm, his movements precise, almost balletic, despite the immense pressure. His scrub cap, pulled low, couldn't quite conceal the fierce concentration etched on his face, a face accustomed to triumphs. He was a surgeon who saw the human body as a complex machine he was uniquely qualified to mend, a perspective that bred both unparalleled skill and, at times, an impenetrable arrogance. Fluoroscopy live. Guide wire to the descending aorta, excellent, Tanaka commanded, his voice a low, steady current in the room. His hands, gloved and deft, manipulated the slender guide wire with the confidence of an artist. On the multiple overhead screens, Sofia's internal architecture shimmered in monochrome, overlaid with the faintly visible progress of the wire, a thin, white line advancing through the labyrinthine arteries. This was the initial phase of the thoracic endovascular aortic repair, TEVR, the critical maneuver to stabilize Sofia's type A dissection, an emergency that had landed her on the table in the dead of night. Javier Kimani, a fleeting shadow at the periphery of Tanaka's grand performance, stood ready with the next set of instruments. His role was supporting, anticipating, reacting. His modesty was a shield, his silence a profound camouflage in this elite environment. Yet, beneath the calm exterior, his mind was a whirlwind of data processing. The live fluoroscopy, usually a secondary observation point for nurses, was Javier's primary focus. His certification in advanced vascular imaging, a skill honed not in a classroom but under the stark, unforgiving conditions of field hospitals, made him see beyond the surface. Prepare the delivery catheter. Stent graft is next, Tanaka announced, his eyes fixed on the main screen, where the guide wire now sat perfectly aligned. Dr. Hadid, confirm our measurements one last time. We are proceeding as planned, distal to the origin of the left subclavian, preserving flow as per standard protocol. Dr. Zara Hadid, the sharp-eyed CT fellow, leaned closer to a tablet displaying the preoperative CTA scans. Her dark, intelligent eyes scanned the images, her fingers flying across the screen with practiced speed. Confirmed, Dr. Tanaka. Everything aligns with the 3D reconstructions. Optimal landing zone identified. The anomalous subclavian origin is noted, but our planned coverage ensures adequate distal perfusion via the vertebral artery collateral network, as expected. Her voice, though respectful, carried an underlying confidence that mirrored Tanaka's own. She was his apprentice, his heir apparent in understanding the intricate vascular landscape. Javier, however, had seen something else. As the guide wire had advanced, and now as the delivery catheter, sheathing the compressed stent graft, was carefully threaded over it, his gaze remained riveted to the fluoroscopy. It wasn't on the main lumen, or the obvious branching vessels. It was an almost subliminal detail, a barely perceptible pulsatile artifact on the periphery of the image, near the expected origin of the anomalous right subclavian artery, which in Sophia's case branched directly from the descending aorta after the left subclavian. This was the tricky part. Standard TEVR often covered this area, relying on collaterals. But this artifact, it was too distinct, too rhythmic. His combat medic training screamed at him: observe, analyze, react. In the chaos of a battlefield, a subtle shimmer on a distant hill could mean a sniper. A faint, irregular breath could signal impending cardiac arrest. Here, in the sterile precision of Aegis, this flicker was just as vital. It was a collateral artery, yes, but this particular collateral was behaving differently from what the pre-op scans had suggested, or perhaps, it was one they hadn't even adequately identified. It seemed robust, far more significant than a typical, minor collateral. It had a strong, independent pulse, suggesting a critical role in distal perfusion, specifically to the anomalous subclavian, and by extension, to the brain via the vertebral artery. The implications hit Javier with the force of a physical blow. If this critical collateral artery, previously unacknowledged or deemed insignificant, was inadvertently covered by the stent graft, the standard revascularization strategy, relying on other presumed collaterals, might be catastrophically insufficient. Cerebral ischemia. Stroke. Sophia, saved from an aortic dissection, would be condemned to a different, equally devastating fate. A bead of sweat trickled down Javier's temple, unseen beneath his mask. He looked from the screen to Tanaka, then to Hadid, both intensely focused on their own validated data. They were moving with the assured swiftness of a well-oiled machine, driven by their perfect plan. Their confidence, usually a source of reassurance, now felt like a crushing weight, sealing Sophia's fate with every millimeter the delivery catheter advanced. Positioning confirmed. Marked for deployment, Tanaka's voice boomed, cutting through the growing internal alarm in Javier's mind. The stent graft, a marvel of biomechanical engineering, was now precisely where it was meant to be, ready to unfurl and create a new, safe lumen within Sophia's damaged aorta. Javier's hands, usually so steady, twitched. His heart hammered against his ribs. He wanted to speak, to point, to shout. But the words caught in his throat. He was a rookie nurse, a quiet presence from a humble background, standing in the operating theater of the world's most renowned vascular surgeon. Tanaka, a demigod in his field, rarely tolerated even a whispered suggestion from his junior residents, let alone a nurse. To challenge him now would be professional suicide, a swift and brutal end to his nascent career at Aegis. But the image on the screen, that insistent, rhythmic pulsatile artifact, flashed in his mind like a beacon of impending disaster. He saw it with crystal clarity, a small, yet powerful artery, not just a collateral, but a vital conduit, whose flow was about to be obliterated. He knew, with absolute certainty, that the vertebral artery collateral network Hadid had mentioned might not be enough to compensate for this specific loss. The anomalous subclavian, fed primarily by this vessel, would starve, and with it, a part of Sophia's brain. A cold dread spread through Javier. He had seen the consequences of missed details, of overlooked anomalies, in situations where seconds meant the difference between life and death. The stakes here were no different, though the battlefield was sterile and hushed. The memory of a young soldier, paralyzed from a seemingly minor oversight during a field amputation, flashed through his mind. That could not happen to Sophia. Tanaka's hand was already hovering over the deployment mechanism. His eyes, though still focused, held a glint of anticipated triumph. Hadid nodded, confirming all pre-deployment parameters. The entire team held its breath, ready for the culmination of their meticulous work. Javier's jaw clenched. The fear of professional ruin wrestled with the unshakable certainty of catastrophic patient harm. He had to decide, now. The stent graft was poised. The irreversible error was seconds away. His junior status, his modesty, his very invisibility, suddenly felt like an unbearable burden. He had to find a way to make them see. The subtle flicker on the screen pulsed, a silent scream in the sterile silence, begging for recognition. Sophia's brain was minutes from being starved. The air in O3 was thick with the silent hum of monitors and the strained anticipation of the surgical team. Dr. Tanaka's shadow loomed large over the fluoroscopy screen, his profile etched with the quiet confidence of a maestro poised for his magnum opus. The stent graft, a finely braided mesh of nitinol and polyester, was perfectly positioned, its proximal marker just distal to the left common carotid origin, meticulously aligned to cover Sofia Petrova's extensive type A aortic dissection. From Tanaka's perspective, the field was clear. The anomaly of the right subclavian artery accounted for in his pre-op planning, a non-dominant vessel, deemed safe for intentional occlusion. Javier, however, saw something different. His gaze was fixed on the pulsating ghost, a faint, rhythmic shiver originating from the subclavian stump, just proximal to where Tanaka intended to deploy. It was so subtle, a barely perceptible flicker against the background noise of the aortic pulsation, yet to Javier's hyper-attuned eyes, it sang a silent, urgent warning. His combat medic training, honed in the chaos of battlefields where microscopic details meant the difference between life and death, screamed at him. This was not noise, it was blood flow. Significant, directed blood flow. He took a shallow breath, the sterile scent of betadine and antiseptic filling his lungs. Dr. Tanaka, he began, his voice a low rumble, barely audible over the whoosh of the laminar flow system. Apologies, sir, but could we perhaps reconfirm the vertebral artery origin relative to the anticipated subclavian occlusion point? Tanaka didn't even turn. His index finger, sheathed in a sterile glove, hovered mere millimeters from the activation button on the deployment device. Nurse Kimani, he replied, his tone smooth, almost purring, but with an underlying steel that brooked no dissent. Every parameter has been meticulously reviewed. Dr. Hadid has confirmed the final position. The vertebral artery is safely proximal. There is nothing further to confirm. We are precisely where we need to be. His words were a polite dismissal, an assertion of absolute authority. Dr. Hadid, standing opposite, her intense eyes flitting between the digital roadmap and the physiological monitors, nodded in agreement. All vitals stable, Dr. Tanaka. Distal pulses strong. No signs of cerebral hypoperfusion at this stage. Everything is optimal. She implicitly trusted Tanaka's pre-op due diligence and her own real-time assessment, which, like Tanaka's, relied on the absence of obvious red flags, not the detection of subtle anomalies. Javier's stomach clenched. The subtle pulsatile artifact had, for him, sharpened into an undeniable reality. He could almost feel the blood tracing its path through that aberrant collateral, a small, yet critical, alternative route, anastomosing with the vertebral artery beyond the intended occlusion zone. If Tanaka deployed the graft now, without accommodating this collateral, the vertebral artery, normally shielded by its direct origin from the subclavian, would be utterly deprived of flow. Sofia's brain, particularly her posterior circulation, would be instantly starved. Not minutes, but seconds. Irreversible ischemic damage. Stroke. Paralysis. Death. The very outcome they were trying to prevent. But sir, Javier pushed, his voice slightly louder, laced with an urgency he struggled to contain, the fluoroscopy. Just above the proximal stent marker, there's a faint, but distinct, pulsatile movement. It appears to be an unmapped collateral directly feeding the vertebral. He knew how ridiculous it sounded. An unmapped collateral spotted by a rookie on a high-res screen where world-class surgeons and advanced imaging had found nothing. Tanaka finally lowered his hand, his posture stiffening, but he still didn't look at Javier. His gaze remained fixed on the screen, but his attention was now entirely on the audacious rookie. Nurse Kimani, are you implying that the preoperative CTA, the 3D reconstructions, the intraoperative angiograms, and my 30 years of vascular surgical experience have all missed a critical vessel, and you have spotted it on live fluoroscopy moments before deployment? His voice, though still controlled, was laced with venom. Do you understand the gravity of that accusation? Or the ramifications of delaying a critical deployment during an acute dissection? The chief resident, Dr. Lee, shot Javier a warning glance from across the table, a clear signal to fall back in line. Even the circulating nurse briefly shook her head. Javier could feel the cold weight of the entire team's disbelief, their silent reprimand. This wasn't a battlefield where hierarchy dissolved in the face of imminent danger. This was Aegis, where hierarchy was as rigid as bone. But Sophia's life was on the line. The memory of the soldier, the subtle oversight, the devastating consequence, it burned in Javier's mind. He saw Sophia's face, her Eastern European features pale but resolute, trusting them. He couldn't let it happen. He wouldn't. The stent graft delivery system was now fully armed. Tanaka's finger began to descend again, a silent, deadly countdown. The monitors continued their rhythmic beeping, deceptively stable. But Javier saw the subtle tremor in Sophia's left eyelid, barely there, but a microsignal from a body on the precipice. The pulsatile flicker on the screen was no longer faint to him, it blazed, a tiny, defiant beacon of impending disaster. "Sir!" Javier practically yelled, his voice cutting through the sterile silence like a sonic boom. Every head in the room snapped towards him, including Tanaka's. The chief surgeon's face was a mask of incandescent fury, his eyes slits of pure rage. "Stop! Wait! You must reevaluate. The collateral is there. You will occlude her posterior cerebral circulation." The deployment button was a hair's breadth from being pressed. The irreversible error, the catastrophic stroke, was literally a fraction of a second away. The team froze, suspended in the moment of Javier's insubordinate, desperate scream. The entire held its breath, poised between the chief surgeon's absolute authority and the rookie nurse's defiant, life-saving alarm. "Are you insane, nurse?" Tanaka roared, his voice a lethal whisper, his finger still hovering over the deploy button. "You dare question a procedure of this magnitude? My expertise?" Javier, though trembling, met his gaze. "Sir, please, look again. Just one more second." Dr. Hadid, an eyebrow raised in annoyance at the rookie's audacity, leaned closer to the monitor, intending to dismiss his claim. But as her eyes focused on the exact spot Javier indicated, a faint, rhythmic flicker, the ghost of a vessel, became undeniable. Her dismissive frown evaporated, replaced by genuine shock. Will this rookie underdog be vindicated? Or will his career end here? Don't miss what happens next. Hit that subscribe button to follow Javier's journey. The deployment button, a polished obsidian disc, gleamed under the lights, an inch from Dr. Tanaka's thumb. Javier's cry, raw and desperate, had shattered the surgical ballet, freezing every hand, every breath, every beat of the monitors. The silence that followed was not merely the absence of sound, it was a vacuum, heavy with professional transgression and the imminent collision of authority and truth. Tanaka's head slowly swiveled, his eyes, usually sharp and focused, now burning with an unholy fire. "Kimani," he hissed, the single word a whipcrack that promised career annihilation. "What in the hell do you think you are doing? Do you have any concept of the protocols we observe in my operating theater?" His hand, still hovering over the button, trembled with barely suppressed fury. "Explain yourself, immediately, before I have you removed from this institution." Javier, heart hammering against his ribs, refused to back down. The tremor in Sophia's eyelid, the defiant flicker on the screen, these weren't figments of his imagination. This was a life. "Sir, with respect, I have explained myself." Javier's voice was surprisingly steady, cutting through the thick tension. The pulsatile artifact on the fluoroscopy, near the anomalous subclavian origin, is consistent with a critical collateral vessel. Deploying the graft as planned will undoubtedly occlude it, leading to a catastrophic posterior cerebral infarct. He gestured frantically towards the main monitor, where the last fluoroscopic loop was still paused. "Look again, sir, please. Before it's too late." A tense murmur rippled through the peripheral staff. Even the scrub tech, usually stoic, glanced nervously between the raging chief and the unyielding rookie. Dr. Zara Hadid, standing by the CT workstation, had initially rolled her eyes at Javier's outburst. Junior nurses simply did not interrupt Tanaka. But the specific, anatomical details of Javier's accusation, anomalous subclavian origin, critical collateral, posterior cerebral infarct, pricked her professional curiosity. She was a fellow. Challenging the chief was unthinkable, but dismissing a potentially life-threatening claim was malpractice. Her gaze flicked to the screen Javier indicated. "Kimani, your insolence is unparalleled," Tanaka snarled, taking a threatening step towards Javier. "There is no pulsatile artifact. Our pre-op imaging, the highest resolution available, showed no such thing. Are you suggesting our advanced volumetric CT angiography missed something so critical that a rookie nurse with vascular imaging certification can see it on live fluoro? Preposterous." "Perhaps, Dr. Tanaka," Hadid interjected, her voice calmer but carrying an edge of her own authority. "He's referring to something subtle. A transient flow phenomenon. Let me rerun that last fluoro loop." She moved swiftly to the console, her fingers dancing across the keyboard. As the scrub tech nervously offered to assist Tanaka with his instruments, Hadid zoomed in on the region Javier had indicated. The image pulsed back to life, the guide wire threading through the aortic arch, the stent graft compressed within its sheath, ready for deployment. Hadid focused the digital magnification, enhancing the contrast. Initially, she saw only what Tanaka saw, a clear field, the anomalous right subclavian appearing to originate distally from the arch, but without obvious critical collaterals. But as the loop replayed a third, then a fourth time, and she adjusted the display window, a faint, almost imperceptible wisp of contrast appeared, then vanished, near the proximal end of the anomalous subclavian. It wasn't a static vessel, it was a fleeting movement. A subtle, rhythmic flicker. Her brow furrowed. It was barely there, a ghost in the machine. Too small, too transient, to be definitively called a vessel on a quick scan. Yet, Javier's description had been so precise, pulsatile artifact. An artifact is often an unwanted visual interference, but in this context, it could be the signature of a collateral. "Javier," Hadid said, her voice dropping, "what precisely are you seeing? Be specific." Javier, eyes fixed on the screen, pointed. "Right there, Dr. Hadid. Inferior aspect of the anomalous subclavian's origin, just proximal to where the main graft would land. Watch the pulsation, it's out of phase with the primary aortic flow, indicating a retrograde supply. It's too faint to be the vertebral from the left, which we know is patent. This could be a major collateral from the costocervical trunk, perhaps feeding into the left vertebral via a distal anastomosis, or even directly supplying posterior circulation components that are normally compensated but now critical due to the dissection." Hadid's breath hitched. Costocervical trunk. Distal anastomosis. Retrograde supply. These were not the ramblings of a panicked rookie. These were the precise observations of someone who understood complex vascular anatomy and hemodynamics. She recentered the image, adjusting the brightness and contrast filter. And there it was. Not a clear vessel, not a definitive artery, but an undeniable, rhythmic blush of contrast, appearing and disappearing with each heartbeat, distinct from the primary flow. It was indeed pulsatile, and it was originating from a location that, if covered by the graft, would be instantly occluded. Her mind raced through the pre-op CT. The segmentation had been perfect, the 3D reconstructions flawless. How could they have missed this? The answer dawned on her: real-time, high-flow dynamics. The CT was static, capturing a moment. Fluoroscopy, especially with a subtle, low-flow collateral, could reveal dynamic interplay that a static image couldn't. It was small, probably tortuous, and likely in a low-pressure zone, making it difficult to detect unless specifically sought with high suspicion, like Javier had. A cold wave of dread washed over her. He was right. Dr. Tanaka had committed to deploying a graft that would almost certainly cause a debilitating, perhaps fatal, stroke in Sofia Petrova. "Dr. Tanaka," Hadid said, her voice now steady, imbued with the crushing weight of her discovery. Her initial annoyance at Javier had evaporated, replaced by stark professional alarm. He's correct. There is a pulsatile flow artifact. It's incredibly subtle, almost certainly a low-flow collateral, but it's there. Just proximal to the planned landing zone. If this is occluded, given the known anomalous anatomy and potential compromise of the circle of Willis due to the dissection itself, it could lead to severe ischemia. The entire room went utterly silent. Tanaka, who had been about to unleash another verbal volley, froze. His eyes, though still blazing, seemed to dim slightly as Hadid's words registered. The sheer, terrifying implication of her confirmation hit him with the force of a physical blow. His perfect plan, his flawless execution, his unparalleled expertise, all now called into question, not by a peer, but by a rookie nurse and confirmed by his own CT fellow. He strode to the monitor, pushing Hadid gently aside. His face was a mask of disbelief, then a growing, horrified realization. His gaze, trained over decades to spot the most intricate vascular details, now scrutinized the screen. He saw what Hadid saw. The spectral, rhythmic blush. He saw the subtle deviation in the contrast stream, the tiny eddy current that bespoke a collateral connection. His mind, arrogant but brilliant, began to reevaluate the pre-op scans, replaying the 3D models in his head, searching for any hint he might have dismissed. It was there, wasn't it? A tiny, ambiguous density, written off as noise. The air in the OR crackled with the sheer weight of his internal struggle. His ego demanded denial, but his surgeon's instinct, his oath, demanded truth. He could feel the eyes of his team on him, the silent accusation of a near-miss catastrophe. The patient on the table, Sophia, represented not just a case, but a human life that had been seconds from permanent injury under his hand. He ran a hand over his scrub cap, a gesture of profound stress. "Loop that," he said, his voice clipped, devoid of its previous fury, replaced by a grim, professional urgency. "And enhance the flow vector. See if we can get a real-time Doppler signal on that specific point." His eyes, now devoid of rage, were fixed intently on the screen, searching for every scrap of evidence. The team, sensing the seismic shift, sprang into action. The interventional radiologist adjusted the C-arm for better angulation, the tech prepared the Doppler. The monitor replayed the image, clearer now, the pulsatile artifact no longer a ghost but a faint, undeniable signature of flow. "Dr. Tanaka," Hadid said, "it's low velocity, but it's definitely there. This isn't an artifact of the machine. It's biological." Tanaka let out a slow, deliberate breath, the sound almost a groan. He closed his eyes for a brief moment, then opened them, revealing a grim acceptance. His reputation, his authority, had just been publicly challenged and, undeniably, proven wrong. But Sofia Petrova was still alive, still intact. And for that, he owed Javier Kimani everything. "All right," Tanaka said, his voice flat but firm, "stand down on deployment. Resheath the graft. We need a new plan. This collateral, however small, is critical. We cannot occlude it." He looked at Javier, his gaze lingering, not in anger, but in a grudging, dawning respect. "Kimani, your observation, it was invaluable. Dr. Hadid, thank you for the confirmation." The words, though delivered stiffly, were a profound admission, a turning point that reverberated through the very foundations of the operating theater. The danger was averted, but a new, more complex challenge had just begun. The reverberation of Tanaka's words, "We need a new plan. This collateral, however small, is critical. We cannot occlude it," settled over the operating theater like a sudden, chilling frost. The air, already thick with the scent of antiseptic and the hum of machinery, now crackled with a new kind of tension, the pressure of radical improvisation. "All right, team," Tanaka's voice, though stripped of its usual bravado, was still decisive. "Sophia has an acute type A dissection extending into the arch. The anomalous subclavian, fed by this newly identified collateral, is a critical cerebral supply. Standard TEVR deployment would cover it, guaranteeing catastrophic cerebral ischemia. We don't have time for a custom fenestrated graft." He swept his gaze across the room, his eyes landing on Javier. "We're doing a chimney technique. We'll establish separate access to the anomalous subclavian, deploy a covered stent parallel to the main endograft, and then deploy the main graft around it, creating a chimney to preserve flow." A ripple of murmurs spread through the scrub nurses and circulating staff. The chimney graft was a highly complex, technically demanding maneuver, usually reserved for elective cases or as a bailout, not a primary strategy in an acute, emergent dissection. It introduced potential for endoleaks, gutters, and kinking, pushing the boundaries of what was considered routine even in this elite hospital. Dr. Hadid, Tanaka continued, prepare the left brachial access. We'll need a 6 French sheath. Kimani. Javier snapped his attention to Tanaka, his heart thrumming. Your observation skills are exceptional. Your vascular imaging certification, your combat medic experience, it speaks to precision under pressure. I need you to cannulate that subclavian from the brachial approach. You'll be threading the wire and microcatheter. Dr. Chen, stand by to assist. The pronouncement hit the room like a sonic boom. Dr. Chen, a senior resident, blanched, but before he could protest, Tanaka's gaze, though weary, brooked no argument. Hadid froze, her instruments momentarily forgotten. A rookie nurse, guiding a microcatheter into a delicate, anomalous vessel? It was unprecedented, unheard of, a direct assault on the rigid hierarchy of the OR. But Tanaka, humbled and under immense pressure, was making a calculated, desperate gamble on Javier's unique aptitude. Javier didn't flinch. His mind was already dissecting the anatomy he'd studied so intently just moments ago. He knew the path. He knew the risk. Yes, sir, he said, his voice steady, reflecting a calm that belied the internal storm. Minutes later, the left arm of Sofia Petrova, meticulously prepped and draped, became a new surgical field. Hadid, still processing the shock of Tanaka's directive, made the incision with practiced efficiency. The brachial artery, a palpable pulse point, was carefully isolated. Sheath in, she announced, her voice tight, the 6 French sheaths sliding smoothly into the vessel. Kimani, your turn, Tanaka commanded, his eyes fixed on the fluoroscopy screen. Javier moved to the console, a sterile drape separating him from the patient. He selected a .014-inch hydrophilic guide wire, its tip gleaming under the stark OR lights. His gloved fingers, surprisingly nimble, advanced the wire into the sheath. On the fluoroscopy monitor, the thin, shimmering line of the guide wire began its journey upstream. Advancing towards the subclavian, Javier narrated, his voice calm, almost clinical. His eyes, trained by countless hours of studying angiograms and navigating combat trauma, were locked onto the live image. He could visualize the tortuous path, the subtle curves, the point of origin of the anomalous subclavian from the distal arch, now partly obscured by the displaced intima of the dissection. The guide wire snaked past the axillary artery, then into the subclavian proper. Every millimeter of movement was agonizingly slow, deliberate. The surgical team held its collective breath. Dr. Chen leaned in, his face a mask of disbelief and reluctant awe. Hadid, her expression unreadable, watched Javier's hands with an intensity that bordered on reverence. Approaching the anomalous origin, Javier murmured, his brow furrowed in concentration. He applied a gentle, almost imperceptible torque to the wire, coaxing it past a subtle bend. On screen, the wire's tip seemed to hesitate, then, with a barely visible flick of Javier's wrist, it found its purchase. A collective, soft exhalation permeated the room. Excellent, Kimani. You're in the subclavian, Tanaka confirmed, his voice edged with a mix of relief and grudging respect. Now, advance the microcatheter. Keep the wire distal. Javier exchanged the guide wire for a diagnostic microcatheter, a hair-thin tube designed for precise delivery into small, delicate vessels. He fed it over the guide wire, his movements fluid, rhythmic. The catheter, a faint shadow on the screen, followed the guide wire's path. Javier navigated the subclavian's acute angulation, a challenge even for seasoned interventionalists. He rotated the catheter, pushed with calculated force, then retracted. Each manipulation was precise, economical. There's the collateral, Javier announced, pointing to a tiny, almost invisible branch on the fluoroscopy. I'm taking the microcatheter directly into it, preserving that distal flow path. Hadid gasped softly. Not only had he cannulated the subclavian, but he was now targeting the collateral itself, An even more audacious and technically demanding feat. The implications of this depth of understanding and skill from a rookie nurse were staggering. Her initial skepticism had long since evaporated, replaced by a profound, almost uncomfortable respect. "Are you sure, Kimani?" Tanaka asked, his voice betraying a hint of his former arrogance, a reflex reaction to the audacity. "That's a tight turn." "Positive, sir." "It's the optimal pathway for distal perfusion," Javier replied, his gaze unwavering from the screen. He applied another precise rotation, and the microcatheter's tip, guided by an intuition born of combat experience and advanced training, dipped into the narrow collateral. Microcatheter in collateral. "Guide wire now advanced to distal vessel," Javier confirmed, his voice steady, even triumphant. Tanaka stared at the screen, a complex mix of emotions warring on his face. He watched as Javier expertly manipulated the system, confirming the position with a test injection of contrast. The tiny vessel, now clearly visible, bloomed with the dye, outlining a perfect, albeit circuitous, route for revascularization. "Unbelievable," Dr. Chen mumbled under his breath, shaking his head. "He sees it," Hadid whispered, almost to herself. "He truly sees it." "All right, Kimani. Guide wire stable?" Tanaka's voice had regained some of its authority, but it was now tempered with a newfound, almost wary, deference. "Stable, sir." "Good. Exchange for the delivery sheath. Dr. Chen, prepare the covered stent graft for the chimney. 6 by 30 mm Viabon, ready to go." Javier, with practiced ease, withdrew the microcatheter, leaving the guide wire in place. Then, he exchanged the diagnostic sheath for a larger, more robust delivery sheath, carefully advancing it over the guide wire into the anomalous subclavian. His movements were precise, confident, almost graceful. The tension in the room remained thick, but now it was a focused, almost reverent anticipation. A surgical tightrope, indeed, and Javier Kimani, the rookie nurse, was balancing on the thinnest wire. The most precarious part of the procedure was now within their grasp, but the main graft deployment loomed, demanding perfect synchronization. The operating room, once a pressure cooker of tension and uncertainty, now held a more refined, precise kind of intensity. Javier's steady hands worked in concert with Tanaka's newfound respect. The delivery sheath was perfectly positioned, a beacon of hope in the treacherous vascular landscape. "All right, Dr. Chen," sheath advanced, Javier confirmed, his voice calm, unwavering. Dr. Chen, the senior resident, nodded, a look of focused determination replacing his earlier apprehension. "Viabon graft ready for introduction, Chief." "Excellent," Tanaka murmured, his gaze fixed on the fluoroscopy screen. "Kimani, maintain distal traction on that guide wire." Dr. Chen carefully advanced the Viabon through the delivery sheath. "We need to be absolutely precise on our landing zone, distal to the vertebral artery origin, proximal to the thyrocervical trunk, entirely within the anomalous subclavian segment we've secured." Javier adjusted his grip, a subtle movement of his wrist ensuring the guide wire remained perfectly taut, preventing any distal migration that could compromise future branches. Dr. Chen, guided by Tanaka's precise instructions and the live fluoroscopic images, slowly fed the pre-mounted covered stent graft into the sheath. The opaque shadow of the stent advanced, millimeter by careful millimeter, until it was perfectly aligned with the target segment of the subclavian artery, telescoping into the sheath already protecting the aortic wall. "Pause," Tanaka commanded. His eyes narrowed, scrutinizing the image. "Position looks good." Dr. Chen, slowly withdraw the outer sheath, deploying the proximal end of the Viabon. Kimani, a small, gentle countertraction on the delivery sheath, just enough to ensure no inadvertent migration. The Viabon, a flexible, low-profile EPT-FE-covered nitinol stent, began to blossom from the end of the delivery sheath, its delicate wire mesh structure expanding to the vessel wall. Javier executed the countertraction with effortless grace, his fingers sensitive to the slightest resistance. The process was painstakingly slow, each fraction of an inch critical. "Good, good," Tanaka encouraged, a hint of satisfaction in his voice. "Now, bring in the balloon for post-dilation." Dr. Kim, 5mm compliant balloon, prepare for inflation. Dr. Kim, the anesthesiologist, a seasoned professional who had weathered many a surgical storm, adjusted Sophia's blood pressure, ensuring optimal hemodynamics for stent deployment. The balloon catheter was advanced through the now deployed Viabahn. Inflate slowly to 4 atmospheres, Tanaka directed. A slight, controlled inflation. The balloon expanded within the Viabahn, gently pressing the stent against the vessel walls, ensuring full apposition and patency. Deflate. Withdraw the balloon. Let's get a quick angiogram. Kimani, microcatheter back in for contrast injection. Javier wasted no time. With the balloon withdrawn, he smoothly navigated the microcatheter back into the newly stent subclavian artery. A quick bolus of contrast was injected. The fluoroscopy screen lit up, showing a beautifully patent subclavian artery, now completely isolated from the dissection, flowing robustly. The collateral supply to Sophia's brain was secured. A collective sigh of relief, subtle but palpable, rippled through the oar. Tanaka permitted himself a small, almost imperceptible nod. Excellent. Flow to the left subclavian is re-established. Brain perfusion is stable, Dr. Kim? Cerebral oximetry holding steady, Chief, Dr. Kim confirmed. No signs of desaturation. Hadid, who had been watching with hawk-like intensity, allowed a faint smile to touch her lips. She met Javier's eyes across the sterile field. He offered a slight, almost self-deprecating shrug. All right, team, Tanaka announced, his voice regaining its previous commanding timbre, but now infused with a new confidence born of success. Phase 2. Main aortic stent graft deployment. Let's get the Cook Zenith Alpha thoracic graft ready. Kimani, ensure the guide wire is still perfectly centered in the true lumen, distal to our subclavian chimney. The team shifted focus to the primary repair. The largest challenge, the anomalous subclavian, was now resolved. Yet, the type A dissection of the aorta remained, a ticking bomb that needed immediate neutralization. Javier confirmed the guidewire's position. Guidewire stable and true lumen access confirmed, Chief. The delivery system for the main aortic stent graft, a much larger, more robust device, was carefully introduced through the femoral access site. Tanaka guided its massive form under fluoroscopy, advancing it meticulously up the aorta. The task was monumental, to perfectly cover the tear in the aortic wall, exclude the dissection flap, and rebuild a single, patent lumen, all while avoiding occlusion of any critical supraortic branches, particularly the newly stent subclavian. Approaching the aortic arch, Tanaka narrated, his voice a low growl of concentration. Dr. Chen, confirm the orientation marks on the graft. We need to avoid any windsock effect or obstruction of the brachiocephalic or left carotid. The graft, once positioned, needed to be deployed with precision, its proximal end landing just distal to the origin of the brachiocephalic artery, but overlapping the very origin of the now protected anomalous subclavian, creating the chimney effect. Deployment sequence initiated, Tanaka announced. The tension in the room ratcheted up again, a different kind of intensity, a final test of their collective skill. The large stent graft slowly unfurled, its robust framework expanding to reform the aortic lumen. The fluoroscopy screen showed the dissection flap compressing, the true lumen widening, a powerful, visual testament to their intervention. Check the chimney. Is it clear? Hadid interjected, her concern for the revascularized subclavian evident. Tanaka squinted at the screen. Looks good. No compression. Excellent flow through the Viabahn. Once fully deployed, a post-deployment angiogram was performed. Contrast flowed through the newly rebuilt aorta, painting a perfect picture, the dissection completely excluded, a smooth, wide true lumen restored. Crucially, all 3 supraortic branches, the brachiocephalic, the left common carotid, and the revascularized anomalous left subclavian, were widely patent, receiving robust flow. No endoleak was visible. The repair was textbook. It's beautiful, Dr. Chen breathed, the first to break the reverent silence. Tanaka nodded, a deep breath escaping his lips. He looked utterly exhausted but profoundly satisfied. Indeed. Beautiful work, team. Sofia Petrova is safe. Dr. Kim, how are our vitals? All stable, Chief, Dr. Kim replied, his voice lighter than it had been all morning. Blood pressure normalized, heart rate steady, cerebral oximetry remaining stable on both sides. We're good to go to recovery. The focus shifted to closing the access sites. Javier assisted Dr. Chin with the meticulous process of closing the femoral artery punctures using an angioseal device, a final, necessary step in the intricate dance of endovascular surgery. The rhythmic beeping of the cardiac monitor, Sofia's steady, even breathing, and the quiet murmurs of the team replacing the sharp commands of surgery filled the air. Disaster had been averted. A life had been saved. Tanaka, removing his lead apron and mask, walked over to Javier. His face, etched with the lines of fatigue, softened as he looked at the young nurse. Kimani, he began, his voice gravelly, what you did today, you saved her from a devastating stroke. You saw what none of us did, even with all our advanced imaging. Your observation was nothing short of miraculous. He extended a hand, and Javier, momentarily surprised, grasped it firmly. The handshake was warm, firm, and carried the weight of profound respect. Just doing my job, sir, Javier replied, his characteristic modesty shining through. His heart, however, swelled with a quiet pride. Dr. Hadid approached, her eyes sparkling with an intensity that Javier had now come to recognize as her particular brand of admiration. Miraculous is an understatement, Javier. Your ability to detect that artifact, it speaks to an incredible level of understanding of vascular anatomy and hemodynamics. Most fellows don't see that kind of detail. That was phenomenal. She didn't shake his hand, but instead placed a reassuring, appreciative hand on his shoulder. You have a unique gift, Kimani. Don't ever let anyone tell you otherwise. Javier met her gaze, a faint smile gracing his lips. The ordeal had passed. Sofia Petrova was on her way to recovery, her brain intact, thanks to a rookie nurse's keen eye and unwavering courage. The operating room, filled with the lingering scent of antiseptic and the hum of machinery, now felt less like a battlefield and more like a sanctuary where expertise had truly triumphed. The surgical tightrope had been crossed, and Javier Kimani had, against all odds, guided them across the thinnest wire. The collective exhalation in Operating Room 3 was almost audible, a wave of palpable relief washing over the surgical team. Sofia Petrova's vital signs, displayed on the monitor, had stabilized. The new, custom-configured branch stent was perfectly seated, perfusing the aberrant right subclavian artery via the newly cannulated collateral, diverting flow from the previously problematic origin, while the main TEVR graft excluded the dissection, safeguarding the aorta. Post-angiography showed robust, symmetrical flow to both carotid arteries and, crucially, to the right vertebral artery via the revascularized subclavian, ensuring uncompromised cerebral perfusion. The threat of a devastating stroke, which had hung over them like a guillotine blade moments before, had been averted. Dr. Tanaka, still standing at the head of the table, his earlier fury replaced by a strained, almost bewildered silence, watched the monitors intently. He personally verified the final images, scrutinizing the arterial tree for any hint of malperfusion or distal embolization. His brow, deeply furrowed in concentration, slowly smoothed as he confirmed the successful cerebral perfusion. The perfect, elegant solution to an almost catastrophic oversight. He turned from the screen, his gaze sweeping over the relieved faces of his team, then settling, finally, on Javier. Nurse Kimani, Tanaka's voice was low, almost a rumble, devoid of its usual sharp edge. Bring up the initial fluoroscopy loop. The one just before graft deployment. Javier, still processing the adrenaline crash, moved to the console, his fingers precise as he navigated the imaging system. The live feed paused, then rewound, showing the precise moment he had called out. On the main monitor, the subtle, rhythmic pulse of the tiny collateral artery, previously dismissed as artifact by even the seasoned CT fellow, shimmered faintly against the shadow of the stent wire. Now, with the benefit of hindsight and context, it was undeniably there, a faint, flickering lifeline, a mere ghost of a vessel that had saved Sophia from a permanent neurological deficit. Dr. Hadid stepped closer, pointing at the screen. There. The pulsatile shadow, just distal to the proposed subclavian origin coverage. Javier identified that this wasn't merely motion artifact from respiration or cardiac beat. He saw it was an intrinsic flow signal, indicating a vital, unmapped collateral. Her voice, usually measured, carried a profound note of professional awe. Most of us, including myself, would have dismissed it as background noise. His training, his background, it gave him a different lens for interpretation. Tanaka nodded slowly, a profound shift occurring in his rigid posture. The chief surgeon, renowned for his surgical prowess and equally for his unyielding ego, was experiencing a rare moment of professional humility. He had almost blinded his patient. "Nurse Kimani," he repeated, his voice gaining a trace of its old authority, but softened by a newfound respect, "explain how you detected that. What was your reasoning in that moment?" Javier, still slightly breathless but regaining his composure, cleared his throat. "Sir, with all due respect, it wasn't just reasoning. It was pattern recognition honed by thousands of hours of vascular imaging interpretation, particularly in austere environments where every shadow, every subtle shift, could mean life or death." He paused, choosing his words carefully, the quiet confidence replacing his earlier nervousness. "During my time as a combat medic, especially with severe trauma and emergent revascularization cases, we relied heavily on portable ultrasound and fluoroscopy to rapidly assess vascular integrity. You learn to distinguish artifact from genuine physiological signals under extreme pressure. The amplitude and frequency of that specific pulsatile shadow didn't match Sophia's cardiac rhythm or respiratory excursions. It was slightly asynchronous, a smaller, independent pulse wave. And its location, right at the confluence of the anomalous subclavian and the vertebral artery, immediately suggested a critical bypass pathway, a vasa vasorum or a small muscular branch that had hypertrophied to supply a vital region. The words hung in the air, revealing a depth of experience no one had suspected from the quiet, unassuming rookie nurse. A collective murmur went through the room. The anesthesiologist, Dr. Chen, who had been monitoring Sophia's neurological status with an intensity that bordered on ferocity, adjusted his spectacles. "Combat medic, Kimani? Is that why your approach to every procedure, every observation, seems to be hypervigilant?" "It's about minimizing preventable harm," Dr. Chen, Javier replied, his gaze unwavering. "In the field, you don't always have the luxury of multidisciplinary teams and advanced diagnostics initially. You learn to extrapolate maximum information from minimal data, to trust your eyes implicitly. And in this case, the subtle pulsatile shadow, it just screamed perfusion pathway at me. Ignoring it felt like ignoring a warning siren." Dr. Hadid interjected, her admiration evident. "And he's not just a combat medic. Javier holds an advanced certification in vascular ultrasound and interventional fluoroscopy interpretation, a credential usually reserved for senior radiology technicians or even some interventional radiologists. He wasn't just spotting something, he was performing real-time, high-level image analysis under pressure that none of us were doing at that moment." Tanaka ran a hand over his face, a gesture of profound realization. "An advanced certification. I see. That explains everything." He looked at Javier, his expression now one of intense professional appraisal. "Kimani, you've just saved this patient from a permanent neurological deficit, and quite possibly, our surgical team from a very dark day. You demonstrated an observational acuity and a courage to speak up that is, frankly, unheard of from a junior staff member. And he paused, a difficult admission for a man of his stature, I almost let my own confidence override a critical warning. For that, I apologize." The apology from Dr. Kenji Tanaka was akin to an earthquake in the hierarchical world of Aegis Medical Center. Gasps were subtly exchanged among the residents and junior staff. Javier, however, merely inclined his head slightly. "No apology necessary, sir. My only concern was the patient's safety. We all strive for the same outcome." His humility was genuine, not feigned. He wasn't looking for accolades, but for the quiet satisfaction of a job done right, a life preserved. Scrub nurse Elaine, who had worked with Tanaka for years, broke the silence with a sniffle, wiping a tear from her eye. That was incredible, Javier. Truly. I've never seen anything like it. Thank you for speaking up. One of the residents, Dr. Patel, a young man who had often seemed intimidated by Tanaka's presence, now looked at Javier with open respect. The precision with which you described the anomaly, Nurse Kimani, and then the immediate correlation to the potential for vertebrobasilar insufficiency, it was textbook, but in real time. I'll be reviewing that fluoro loop for months, trying to see what you saw. The operating room, once a chamber of tense command and strict hierarchy, had transformed. The invisible barrier between the doctor and nurse had thinned, almost dissolved. Javier Kimani, the quiet rookie, had proven his mettle in the crucible of an emergency, not through bravado, but through meticulous observation and a profound understanding of his craft. He wasn't just a pair of hands, he was a vital, independent diagnostic mind. We need to document this thoroughly in the post-op review, Dr. Hadid stated, her voice firm, taking charge of the next steps. The anomalous subclavian origin, the previously unmapped collateral, and the modified revascularization technique. And critically, Javier's detection of the pulsatile artifact that prompted the intervention. This needs to be part of our morbidity and mortality conference, but as a sterling case study in vigilance and the critical role of every team member, not an error. She looked pointedly at Tanaka, who nodded in agreement, his usual stern expression replaced by one of thoughtful introspection. As the team began the final steps of closing and preparing Sofia for transfer to recovery, Javier moved quietly, assisting where needed, his movements fluid and efficient. The praise, while validating, hadn't changed his core focus. The patient was stable. That was the only true measure of success. He caught Dr. Hadid's eye across the room. She offered him a small, knowing smile, a silent promise of future advocacy, a recognition of a shared understanding that transcended rank. The lingering scent of antiseptic and the low hum of machinery in the OR now felt less like a battlefield and more like a hallowed space where, for once, the traditional hierarchies had yielded to pure, undeniable expertise. Javier Kimani, the quiet rookie, had not just saved a life, he had quietly, definitively, reshaped his own professional standing within the elite walls of Aegis Medical Center. The surgical tightrope had indeed been crossed, and Javier had proven himself the most astute guide. The hushed efficiency of the Aegis OR, usually a crucible of high-stakes tension, now thrummed with a different kind of energy, one of profound relief and a quiet, almost reverent awe. Sofia Petrova, her chest meticulously closed, was wheeled out with an anesthesiologist and a critical care nurse flanking her, heading for the cardiothoracic ICU. Her blood pressure was stable, distal pulses palpable, and most importantly, her neurological status, meticulously checked multiple times by Dr. Hadid and the neuroanesthesiologist, appeared intact. The specter of a devastating stroke had receded, replaced by the promise of recovery. Dr. Tanaka, still clad in his surgical scrubs, walked away from the operating table with a gait that, while professional, carried a new gravitas. The arrogance that usually preceded him into a room seemed to have been shed like an old skin. He paused by the scrub sink, looking at his reflection. The image wasn't of the infallible chief surgeon he usually saw, but of a man who had been minutes from a catastrophic error, saved only by the most junior member of his team. This wasn't a defeat, but a profound re-education. He knew, with sharp clarity, that Aegis Medical Center, indeed the entire vascular surgery community, would discuss this case. His reputation, while unblemished by failure thanks to Javier, would forever be linked to the humility he displayed in the face of a rookie's undeniable insight. The very next morning, Tanaka called for an unscheduled morbidity and mortality (MNM) conference, not to dissect a failure, but to laud a near miss averted. This was unprecedented. Before a room packed with residents, fellows, attendings, and even a few hospital administrators, Tanaka presented Sofia's case, meticulously detailing the anomalous subclavian and the critical, missed collateral. He projected the intraoperative fluoroscopy loop, highlighting the faint pulsatile artifact Javier had identified. Then, with a voice devoid of ego, he brought Javier Kimani, in his standard-issue nurse scrubs, to the podium. Nurse Kimani's observation saved this patient from certain cerebral ischemia, Tanaka stated, his gaze sweeping the room. His vigilance, his precise interpretation of subtle data, and his courage to speak up, exemplify the highest standards of medical practice. We were all blind, and he saw. This institution owes him a profound debt of gratitude. The applause was immediate, genuine, and thunderous, a true tectonic shift in the hierarchy of Aegis. For Dr. Zahra Hadid, the incident had solidified her respect for Javier. Her initial skepticism, now proven utterly unfounded, served only to underscore the veracity of Javier's observation. She'd always prided herself on her sharp eye and analytical mind, yet she too had missed it. The experience ignited a new kind of intellectual curiosity within her. During Sophia's ongoing recovery in the ICU, Hadid was a constant presence, not just monitoring the patient, but often seeking Javier's input on imaging nuances, discussing subtle findings, and even suggesting they co-author a case report on the anomalous collateral and the intraoperative detection method. She became Javier's most vocal advocate among the physician staff, frequently citing his advanced vascular imaging certification as proof of his specialized expertise, pushing for his inclusion in interventional radiology rounds and complex preoperative imaging reviews. Her path, once singularly focused on climbing the ranks of diagnostic radiology, now seemed to branch towards interdisciplinary collaboration, a direct consequence of Javier's impact. Sofia Petrova's recovery was, thankfully, uneventful from a neurological standpoint. The adapted TEVR had successfully excluded the dissection while preserving critical cerebral perfusion. She spent 5 days in the cardiothoracic ICU, her vital signs meticulously monitored, neurological checks performed hourly. Dr. Hadid's diligent postoperative CT angiography confirmed the elegant solution, the branch stent preserving flow to the vertebral artery via the collateral, the main graft perfectly seated. Slowly, Sophia regained strength. Her family, initially distraught, blossomed with relief. Days later, Javier, during his regular ICU rounds, found Sophia awake and lucid. She looked at him, her eyes still a little hazy from medication but clear with recognition. "The nurse, you saved me," she whispered, her voice weak but steady. Javier, characteristically modest, simply smiled and took her hand, a gesture of shared humanity. Her journey to full recovery would involve strict blood pressure control, lifelong antiplatelet therapy, and regular imaging surveillance, but she would walk out of Aegis neurologically intact, a living testament to the power of a single observation. Javier Kimani returned to his authentic life, which for him meant a quiet dedication to his profession, but it was a life irrevocably altered. The subtle dynamics of Aegis shifted around him. Nurses, once quick to dismiss the new rookie, now sought his opinion. Residents, initially condescending, asked for his insights during rounds. Attendings, including those outside vascular surgery, offered respectful nods. He found himself being pulled into more complex cases, often asked to take a look at fluoroscopy or CT images when something seemed off. The head of nursing expedited his advanced training modules, recognizing his unique value. He was offered a position on the hospital's newly formed Vascular Imaging Review Board, a small, interdisciplinary committee tasked with scrutinizing complex preoperative scans. This wasn't about fame for Javier, it was about the opportunity to apply his skills where they mattered most, to ensure no other patient came as close to a preventable catastrophe as Sophia had. He remained humble, his focus unwavering on the patient, but now carried a quiet confidence, born of proven competence. The ripples of Sofia Petrova's case extended beyond individual careers. Aegis Medical Center, always striving for excellence, initiated a comprehensive review of its preoperative imaging protocols for complex aortic cases. An internal audit revealed that while standard imaging was excellent, the specific collateral Javier had spotted was indeed difficult to discern and could be missed by even experienced radiologists under time pressure. New guidelines were introduced, emphasizing dedicated high-resolution angiographic sequences for patients with known arch anomalies and, crucially, mandating an additional live fluoroscopy review by an independent, trained observer, a role Javier was uniquely qualified to fill during the pre-graft positioning phase of TEVR. The incident, rather than being swept under the rug, became a foundational teaching moment, solidifying a new commitment to interdisciplinary vigilance and empowering every member of the surgical team, regardless of rank, to speak up. Javier Kimani, the quiet rookie, had not just navigated the elite hierarchy of Aegis Medical Center, he had subtly, profoundly, reformed it. His story became a quiet legend in the sterile halls, a testament to the idea that true expertise often resides not in the loudest voices or the highest ranks, but in the keenest eyes and the courageous hearts. He proved that within the intricate dance of modern medicine, where technology and human skill intertwine, the most powerful tool remains the human capacity for observation, for critical thought, and for the unwavering conviction to protect a life. His legacy at Aegis was not just a saved patient, but a reaffirmation that every member of the team holds the potential to be the essential link, the one who truly sees. Javier, now more confident but still grounded, stood quietly, observing the complex angiography of a new, exceptionally challenging aortic case. Dr. Tanaka, who once dismissed him, now approached, a rare look of deference in his eyes. "Kimani," he began, his voice softer than before, "this one's tricky. Your unique perspective on collateral flow. I'd appreciate your initial thoughts." It was more than an invitation, it was an acknowledgement of his irreplaceable insight, a direct consequence of his courage. This story of Javier isn't just about a single patient saved, it's a testament to the power of vigilance, the courage to speak truth to power, and how one voice can reshape an entire system. What moments of unexpected wisdom have you witnessed? Share your stories in the comments below. If you were inspired by Javier's journey, hit that like button and subscribe for more tales of medical innovation and unsung heroes. Remember, true vision often comes from the most unexpected places.